EU pushes for wider outdoor smoking and vaping bans to combat health risks. In a significant public health move, the European Union is set to recommend broader bans on smoking and vaping in outdoor public spaces, including playgrounds and cafe terraces. This comes as health ministers from the EU's 27 member states convene in Brussels to discuss the implementation of stricter anti-smoking legislation aimed at combating secondhand smoke and enhancing public health. The recommendations, which stem from a draft by the European Commission in September, signal a robust stance against nicotine-related products amid rising concerns over their health impacts. The non-binding nature of the recommendation respects the health policy autonomy of the individual member states, but underscores a shared vision towards a drastic reduction in smoking rates across the bloc. According to EU officials, the aim is clear: to see the EU's smoking population, currently at 25%, reduced to below 5% by 2040. This ambitious target is part of the EU's Beating Cancer Plan, which seeks to address the significant public health and economic burden posed by smoking-related diseases. The World Health Organization, WHO, estimates that tobacco use leads to more than 8 million deaths globally each year, which includes approximately 1.3 million non-smokers affected by secondhand smoke. The proposed measures include extending existing cigarette bans to cover emerging products like heated tobacco devices and e-cigarettes, which are gaining popularity particularly among the youth. This broadened scope aims to provide effective protection from the aerosols emitted by such devices not only indoors, such as in offices and other public buildings, but also in certain outdoor areas. However, the move to treat tobacco products and electronic devices equally has sparked some controversy. Italy and Romania have expressed dissent in a joint declaration, pointing out a perceived lack of scientific grounding behind the inclusion of outdoor vaping bans in the recommendations. Nonetheless, diplomatic sources expect these countries to support the overall text. Last week, the European Parliament saw political divides deepen over this issue when it voted against a similar text. Amendments proposed by right-wing lawmakers to differentiate traditional tobacco products from electronic devices fractured the consensus, leading to the rejection of the resolution. Despite these challenges, the EU's push for a smoke-free environment is seen as a critical component of its broader health and wellness strategy, emphasizing preventive measures and public health safeguards. The final approval of the recommendations by the EU health ministers would mark a pivotal step towards not only achieving the Beating Cancer Plan's objectives, but also setting a strong precedent for public health policy across the region and potentially globally. Thank you for choosing Satori News.